Yeah, sir, we are good to go.
Yes.
The
Shall
session,
I start?
yeah, sir.
I see you have to introduce Sir
Yeah, sir.
Mustaq. Maybe I can
Yeah, sir,
introduce.
Mustaqshar, sir, I think he will be introducing.
Okay. Okay.
Yeah, good morning, team. Good morning, sir. Sir, today we would like to discuss about the chronic idiopathic urticaria condition. Actually, so doctor is a speaker, Dr. Narayan Rao, sir. He's a retired HOD of Vizag KGH Hospital, and doctor is having a vast experience in biologics, and doctor is having a more than a 30 years, 35 years of the experience in the dermatology segments, and doctor is having a robust experience in treating with a different types of diseases, and sir is having a vast experience in chronic idiopathic urticaria condition treatment pattern and biologics treatment. Sir, over to you, sir.
Yes. Good morning, all of you. Regarding this patient awareness program about urticaria and angioedema, it's a very common problem. 1 in 5 people in their lifetime, they develop this problem. Patient can notice hives or urticaria. We commonly call it as chalitum or daddula antamu. So it's a very common problem. మనం అంటే స్కిన్లో పైకి ఎలివేటెడ్ ఇచ్చి రెడ్ లీజన్స్ చూస్తాము. అలాగే సమ్టైమ్స్ ఈ లిప్స్ కానీ ఐలిడ్స్ కానీ ఈ హ్యాండ్స్ కానీ బాగా స్వోలెన్ అయిపోవడం అది చూస్తుంటాము. సో ఇట్స్ ఎ వెరీ కామన్ ప్రాబ్లం. Regarding the incidence, acute urticaria can affect up to 15 to 25% of all individuals. It is estimated that 1 in 5 people will have urticaria once in their lifetime. Women are affected twice more likely than men. It's a very common problem. Coming to Indian scenario, around 20 to 30% adults suffer from physical urticaria. And regarding the overall prevalence of cholinergic urticaria, it was found to be 4.16% in Western India. And what are the symptoms? I already told you that it is characterized by itchy erythematous wheals. They can occur anywhere on the body, can occur on the face, trunk, and limbs. They are red itchy areas on the skin. The size of the lesions can vary from few millimeters to many centimeters. It can occur all over the body, and which can produce, if urticaria occurs entire body, the patient can feel giddiness. Sometimes they can go into unconsciousness. The common symptom with urticaria is itching. Patient will have severe itching and burning sensation. And these urticaria or hives can occur any part of the body, most common on arms, legs, and trunk. It can last for few minutes or several days. So urticaria can persist for few hours, or it can persist for many hours or days. Sometimes it can be associated with angioedema. The angioedema is characterized by diffuse swelling of lips or eyelids, or any loose tissues. And if it occurs in the respiratory tract or laryngeal area, it can produce severe suffocation and breathlessness. It's an emergency which has to be managed immediately. So it's a very serious emergency situation if it occurs in the respiratory tract, especially laryngeal area. It can occur following any insect bites, or sometimes foods like nuts can produce severe angioedema. If it occurs in children without an urticaria, we have to suspect hereditary angioedema, which is relatively rare. This angioedema primarily occurs on the face, eyelids, lips, mouth, upper airways, genitalia, and extremities. Coming to types of urticaria, what are the types of urticaria? A duration, but depending upon the duration, it can be acute urticaria, usually lasts for less than 6 weeks. And if it persists for more than 6 weeks, we call it chronic urticaria. Both are common. Chronic urticaria, if it persists more than 6 weeks, can be idiopathic urticaria, also known as spontaneous urticaria, where we don't commonly find the cause, exact cause. It's very difficult to know. In spite of investigations, we fail to identify the cause. So that's called idiopathic and spontaneous urticaria. The inducible urticaria, they usually will be associated with exposure to sunlight, pressure, friction, cold. Exposure to cold, sometimes winter cold, can produce urticaria. Following exposure to sunlight, people develop urticaria. And sometimes after exercise, patients can develop urticaria. That's we call it cholinergic urticaria, wherein the urticaria is characterized with small lesions with a flare around the lesion. And contact with rubber or sometimes substances, some substance can produce urticaria. These are called inducible or physical urticarias. Coming to impact of urticaria, profound impact on the quality of life can occur. It can produce distress to the patients and can produce disturbed sleep. It can affect daily activities such as absence of work, absence from work. Children may not go to school because of severe urticaria, and it can produce effect on the social life of the individual. It can be embarrassing because of the itching, and patient scratches because uncontrollable itch will be there. And coming to causes, what are the causes or triggers for urticaria? It can be due to foods, it can be due to drugs, it can be due to some insect bites. So we have to take a detailed history for the cause of urticaria. Acute urticaria is commonly seen in children. Chronic urticaria mostly we see in adults. Acute urticaria, usually we know the cause. It can occur in children, especially following viral infections, bacterial infection. Child may have upper respiratory infection, and children can have fever, high fever, cough, cold. So we can know the cause. And it can occur following any infestations, worm infestations, any infections like boils. So acute urticaria, usually the cause is known, and it lasts for a few days to few weeks. Generally, spontaneously it subsides. Once the infection or drug is withdrawn, the acute urticaria subsides. Whereas the chronic urticaria usually lasts more than 6 weeks, and it is very difficult to identify the cause. Usually it is an autoimmune reaction because of formation of autoantibodies in the blood. So it's very difficult to identify the cause in chronic, spontaneous, or inducible urticaria. It can occur as a reaction to infection or emotional stress. And when a person develops urticaria, what are the serious emergency situations? So if a person develops breathing difficulty, so that indicates the angioedema might have occurred in the respiratory tract, especially laryngeal area. So it's an emergency situation. One should be very careful and immediately seek attention of the doctor, and they have to go to nearby hospital. And sometimes if angioedema occurs in the oral cavity, swallowing may become difficult. The patient can feel ill, and the patient may develop fever, chills, sweating, headache, and muscle pains, etc. Coming to diagnosis of urticaria, children, we can identify the cause because of associated infections. So acute urticaria, we can find the cause, but the detailed history is very important. We have to take the detailed history, whether they have taken any food following which the patient might have developed urticaria, like taking nuts, which are notorious to produce urticaria. Shellfish are very notorious in so common foods that produce urticaria. We have to take history, especially egg, proteins. So shellfish, milk, nuts, berries, dyes, and food preservatives and additives. So these are the common offending agents. So history is very important in diagnosis of urticaria. And exposure to heat, cold, in case of physical urticarias, exercise. So history is very important in the diagnosis of urticaria. And exposure to pollens. So dust allergy is very common in adults. So we had to take the history of exposure to pollens, animal fur, exposed to insect bites, stings, exposure to heat, cold. So the detailed history is important, and history of intake of drugs. Because drugs are also commonly implicated in inducing urticaria. So exposure to taking penicillin injections, aspirin, sulfur drugs, which can produce urticaria. And how to confirm? We have to do blood tests. Any infections are there, we can do to confirm the particular infection. And any autoimmune disease, we have to look for antibodies. And allergy testing, especially we do absolute eosinophil count. If it is more than 500, we can think of allergic urticaria. And serum IgE levels indicate if they are high. Depends on the titer, depends upon the normal titer, depends upon the age of the individual. Usually, if it is more than 350, especially in adults, it indicates the patient having allergic urticaria. And skin prick test also sometimes we do with common allergens like foods, dust, house dust. House dust mites are also commonly produce urticaria. So once we diagnose urticaria, how to treat urticaria? So urticaria, first thing is, if we know the exact cause, we have to treat the cause. And if it is drugs, due to drugs, we have to withdraw the drugs. These are the two things we have to do. So taking detailed history, and once we know the cause for urticaria, we have to avoid the cause, especially drugs and infections. Infections, we have to treat infections. After that, antihistamines, the control of itching and urticaria can be done by oral antihistamines. So oral antihistamines, we have two types, sedating and non-sedating. So usually we use for acute urticaria, we can use both sedating and non-sedating, H1 and histamines we use. Chronic urticarias are treated with non-sedatic antihistamines. And we have different types of antihistamines like chlorpheniramine, and they are sedating, and hydroxyzine, which is also a sedating, which is commonly used. So hydroxyzine, commonly the first drug which was introduced for cataracts. So hydroxyzine is commonly used in acute urticarias, and non-sedating antihistamines like fexofenadine, then belastine, so levocetirizine, cetirizine, these come under non-sedating antihistamines. So, and if for the patient we cannot control with antihistamines, then the antihistamine dose we increase 2 times or 3 times, up to 4 times we can increase non-sedating antihistamines. So even in spite of increasing dose of non-sedating antihistamines, the urticaria is not controlled. We have to go for biologics like omalizumab, which is to be given once in a month, 150 to 300. Usually we give 300 milligrams omalizumab once in a month. So usually it's a very effective drug. And if sometimes if we cannot control with omalizumab, generally omalizumab, it has to be given we have to admit the patient and keep the patient for 3 hours. And if there is no adverse effects, then we discharge. And omalizumab is a very effective drug. If for the patient doesn't get relief in spite of taking oral antihistamines and omalizumab, then sometimes we give immunosuppressives like cyclosporine. Cyclosporine, we should be careful with cyclosporine because it can produce adverse effects. So though it's a very effective drug, it can produce adverse effects like hypertension can develop, patient can develop hypertension. So, and we have to look for any increase in potassium. So we have to be careful in using immunosuppressants. Other immunosuppressants are also there, but generally we prefer cyclosporine in chronic spontaneous urticaria. So I would like to have interaction because any doubts are there, I would like to answer.
Sir, just sir, thank you very much, sir, for your valuable suggestions and insights what you given to us, sir. Sir, just 2-3 questions has been raised, sir, from the audience, sir.
Yes.
First one, sir, about the IgE levels. If IgE levels is elevated, apart from this, any oral antihistamines which is effective to reduce the IgE levels, sir?
Generally, IgE, we don't treat basing on the levels of IgE. So some people, even a normal IgE can also have, we don't treat IgE. We treat the symptoms and the cause. So IgE is an indication for that the patient is having an allergy. So
Okay.
Otherwise, we don't treat the basing on the IgE.
Okay, sir. If eosinophil levels and IG levels both are elevated.
No, they indicate that the patient is having allergy. So,
Yes.
and if it is very high, we look for any other atopic disorders like atopic eczema, asthma. So they are an indication that the patient is having an allergy. To be an allergen like house dust, this is an indication that the patient is allergic to any food or dust, house dust. So that's an indication of it. We don't treat basing on serum IgE levels. Even in spite of giving antihistamines and these biologics and immunosuppressants, the IgE level may not come down. But it can spontaneously, if the patient avoids the allergen, they may come down. But treatment will not be based on IgE level only.
Yes.
We look for the cause. To identify the cause and avoid the cause and treat with antihistamines. The patient doesn't respond to antihistamines, then we go for biologics especially omalizumab. And if a patient doesn't respond, then we go for cyclosporine. We try to avoid steroids. That's very important message I want to give. Patient should not take steroids, oral steroids, because once the patient starts taking, the patient responds very fast. But once they stop it again, the urticaria increases. And in the patient, especially chronic urticaria, it can last for months to years. Some people, they develop the urticaria basis for more than 5 years, 10 years. So steroids should not be taken. Generally, steroids we give only for 2 to 3 days and high dose and then stop it. We never encourage patients to take oral steroids or injectable steroids.
Yes, sir. Thank you, sir. Sir, itching is a common problem in chronic idiopathic urticaria, sir.
Yes.
And it is a severe problem to the patient, sir. So,
Yes.
how fast itching will be come down? Any medication means any particular drug that you choose to your patient, sir, that the itching will be come down in a urgent, in immediate basis, sir.
The immediate basis, we give antihistamines. They act very fast. So antihistamines, either H1 sedating antihistamines like chlorpheniramine maleate, that's commonly known as Avil, or hydroxyzine, we commonly people know as Atarax. So these and a combination of sometimes we combine sedative and non-sedative. Sedative antihistamine in the night time and non-sedative fexofenadine or bilastine we give daytime. So we sometimes combine sedative antihistamines, especially hydroxyzine in the night time, and daytime we give levocetrizine, cetirizine, or bilastine. Sometimes if it is very severe, just we give a short course of oral steroids. Fast relief can occur with antihistamines and short course, 1 to 2 days, either oral or injectable steroid.
Yes. Thank you, sir.
But we should, patient should never continue oral steroids or injectable steroids, because a lot of complications can occur with the steroids.
Correct, sir. Sir, hives, sir. Second point is hives, sir. Sir, how to diagnose this hives? First thing, sir, and because only experts like you can easily diagnose the hives and treatment pattern of the hives. Can you please explain, sir?
Hives. This usually patient comes with the diagnosis of hives. They say that chalitam vachindi, daddurlu vachayi. They want only the cause for diagnosis is not difficult. Patient himself or herself, they say maaku chalitam vachindi, daddurlu vachayi. So diagnosis is not difficult. Only thing is we have to know the cause for urticaria, whether it can produce serious complications, or how long it persists. Will it subside in short term, or will it take long term? Patient wants to know whether urticaria, how long the urticaria lasts, and they want a symptom relief. Symptom relief we do with oral antihistamines. And usually the acute urticaria subsides a short time, so less than 6 weeks, usually few weeks. Whereas chronic spontaneous urticaria, it takes long time. Sometimes 1 year, 2 years, 3 years. So 50% of the people chronic urticaria, it subsides by 1 year. So in 30% of the cases, it can last up to 5 years. In 5% cases, it can last for more than 10 years. So patient usually comes with the diagnosis. Confirmation, usually history gives the cause for urticaria. So detailed history is very important. And we do tests like absolute eosinophil count, serum IgE, prick test. So these can be done for the diagnosis or confirmation of the disease.
Yes. So last one question, sir, actually, about if you use any biologic to the patient, especially in chronic idiopathic urticaria, how long patient can be without medication, sir? how long it will be sustained to the patient?
But usually, biologicals, this Malijumab, Emjumab, we give 300 mg once in a month. Usually it takes 4 to 5 months. We have to give injection. Remission period, it varies from individual to individual. Sometimes the remission can be there for few months or a few years. But usually patient need to take these biologics on and off. But usually what I observed was minimum 3 to 4 doses we have to give once in a month.
Yes. Thank you, sir. Thank you very much for your valuable suggestions.
But the advantage with biologics is adverse effects are very less. Only thing is the patient needs to be observed for 3 hours in a casualty setup. That's the only disadvantage with biologics. Otherwise, it's a safe drug. We can, patient gets relief, and side effects are compared to cyclosporin, long-term steroids. It's a safe drug.
Yes, sir. Thank you, sir. Thank you very much for your insights, valuable insights, sir, and inputs, sir, about the chronic idiopathic area. And thank you very much, team, for joining, sir. Thank you, sir. Thank you very much.
Thank you. Thank you all for the opportunity. Thank you.